All right, so welcome. I want to know where you're joining in from. Drop it in the comment section as we get straight in the conversation we have today. Earlier in the week, I heard some very troubling things that even my entire medical education never got me to understand concerning sickle cell and how it's really affecting the people who have that condition. So in today's episode, we're not going to have me talk about this. We're going to have people who are really experiencing this to share their story. This month of September, there's a global awareness and literacy campaign on sickle cell. And we, my family companion, in partnership with the Medical Women's Association of Nigeria, have had the privilege of inviting two sickle cell warriors. These are individuals living with sickle cell anemia coming to share the story of their experience in ways that no medical doctor, no medical textbook, no material anywhere on earth could really communicate that experience they have. The first guest that we are going to be joining just shortly is Kemi. Kemi, for 18 years, never understood what was happening to her. She had been there. In fact, a blood test that was done multiple times between her birth till she was 18 has shown her to be AA blood genotype. So to then be having events that were very inconsistent with what she was taught to be was very traumatizing. Kemi had been called a witch even by medical professionals in the health sector. Kemi had been labeled all kinds of names, and she lived with that trauma up until the age of 18, when for the very first time she got a diagnosis of her situation. And according to her, she said she was even relieved to know that what was happening to her had a name. I don't want to maybe spoil the story for you. I want you to hear from the lady herself. And for 21 years, Kemi had continued to push an advocacy that eventually got the government of her state to make care, medical care for individuals suffering with sickle cell crisis, to be completely free of charge in her state. An amazing lady doing amazing things in her small corner of the world. And after that, we're going to listen to the second sickle cell warrior, Dr. David, who is a medical practitioner in Saudi Arabia, a Nigerian, and has lived with sickle cell for more than 4.5 decades, nearly 5 decades right now. He's a dad, he's an author, he's a medical doctor. And from Dr. Dave, I heard something I've never heard before. That sickle cell pain is more painful, at least 3 to 4 to 5 times more painful than labor pain. And not from a subjective viewpoint as a male having the experience, but because he is a medical doctor and he has interacted with women who have sickle cell and who have gone on to bear children. And those women said what they go through in labor is nothing compared to the pain that the crisis gives when it comes. In fact, many of these women, when they're in labor, people get to ask them, woman, are you really in labor? Because they don't really get to express so much pain as they, compared to the experiences they've had multiple times with sickle cell crisis. And when I heard that, because I've been in the labor process for so many women giving birth, and I know the pain. I was there when my wife gave birth. I was there from the beginning to the end, the moment our baby came. And I know the pain she went through. Now, for someone to say that they have been in this pain for more than 50 years, sometimes 4 times, 7 times, in a month, in a quarter, in a year, nearly 20 times, it is just so terrible. And he gets to share his story, share his experience, and I know you want to listen to that. If you are a parent with a child with sickle cell, or you are someone right now with the AS genotype, you want to listen to this keenly, because it's going to get you to understand that these are not issues to just take for granted, because it's not an experience you want even your enemy talk more of your child to experience. And if you're someone living with sickle cell, you want to hear these stories and see how you could connect to people who have navigated ways around this and see how you could also benefit. All right, without taking much time, let us switch right now and have Kemi join us on this presentation. So today we have Oluwakemi Oguntimehin. She has sickle cell and has turned this into a passionate advocacy. She's a genetic counselor and the founder of the Ignite Sickle Cell Initiative and Sickle Cell Academy. She's dedicated more than 8 years to empower families in reducing infant mortality and giving caregivers the tools from a first-hand experience to raise children with sickle cell in dignity and in good health. Kemi, I'm so thrilled to have you here today. Thank you for joining us.
Thank you for having me.
All right. Without taking much time, we just want to do this in just a short window because I know you have work ongoing for which we just had you join us on this call. You've turned your own experience with sickle cell into a platform for change. Can you tell us what moment did you decide to do this? And you said, I'm going to become an advocate.
I think the turning point was actually when I realized that there was no enough information on sickle cell. Right when I grew up, my diagnosis was kind of late. Like I was often sick, going to the hospital, and then they kept treating without a proper diagnosis. The first test I did, genotype test, came out at AA. So because of that result, it made everybody to actually think it is spiritual, because how do you explain that they said somebody has a genotype AA and this child is always having blood transfusion almost every month or almost every 2 months? It doesn't really make sense. And then at a point in time, you can actually see the clinical pictures of somebody living with sickle cell, yet the result was saying it's AA. So it took a lot of time, and then that thing actually exposed me to a lot of misconception, stigma, discrimination, spiritual labels, and all that. So I think when I was in 100 level, I studied biochemistry. And at that point in time, I had access to a phone, and I started, I was sick. So I went back to the hospital and then they re-diagnosed. Like, let's do this test again. And that point in time, my diagnosis came at sickle cell. So I was 18 when I got properly diagnosed for sickle cell. And at that point in time, I was like, oh, so definitely this thing has a name finally, because I was so happy to know that this is sickle cell. It's not really spiritual, it's not because of other things. Then I started making research on how to manage sickle cell, because the question I was asking, they were not being answered, right? People, I was asking questions: why do I have to leave this? Why is my eyes yellow? Why do I have to come back to the hospital for blood transfusion? And so many things. And then, there's always misconception from the health workers. Like, we use a private hospital mostly because my father believed that private hospital will attend to you faster, right? So because of that, man, there's something that happened. I did a blood transfusion for like regularly. I was sick for like a month or 2 months. I was at the hospital, and then blood transfusion was very regular. And this woman came, which is the HOD of the lab, and said, because I came out to check, and then my PCV was back to 22. And the woman was like, "Hi, Kemi, are you sucking your blood? Why, after all the blood transfusion that you took, why is your blood back to 22? You better go and tell your people, your people better go and tell them to stop sucking your blood. And if you are the one sucking your blood, you better go and stop it." And at that point in time, I was asking myself, like, what's wrong? I didn't know. Like, okay, the normal PCV is supposed to be 35. How come I have a very low one? So I decided to, like, okay, that day I picked my phone. Then luckily for me, I saw this blog. The blog was created by in Nigerian America in the US, and she called it Sickle Cell Warriors Incorporation blog. So there was a lot of information on sickle cell. Like for 1 week straight, I was waking up and sleeping on that blog, reading every information. So from that blog, I started reading more about how, and then it occurred to me, I do not have this access in Nigeria. I did not have access. So, how do I ensure that people don't go through this kind of misconception? People don't go this kind of labels. And then that was what actually,
Inspired you to get
like,
on
that
this.
was where everything started. Like, I really wanted people to have access. The same access, because this is not like, it wasn't a common access then. A lot of people do not have phone. A lot of people do not have browsing phone. It's like a privilege for you to have a browsing phone then. And at that point in time, I was like, how do I bring this information to people in the rural community? That same community that I grew up. How do I ensure that parents don't label their children as witches? How do I ensure that they have the necessary, like that person who is an health worker, if this person has access to the right information, the person will not say, I'm sucking my blood, I'm not sucking, right? So that was the
Amazing,
beginning of
amazing,
everything.
amazing. Do you mind? Let me just take you back the memory lane. Where was this 100 level? What year was that?
That was 2009.
2009. Yeah, that was true. 2009, we still had BlackBerry, Android phones was yet to get into the market. We had Nokias and all of those things. So internet wasn't really this trendy as we have it right now. And
Yeah.
can I also ask where was this test done? You were in the village or in the city?
It's not a city, right? I'm in
Okay.
Ondo State, and I'm not living at the capital.
Okay.
Yeah, I'm living at the Akoko side, so which
Okay.
you cannot say that is the city, right? But even though I'm staying at the biggest town in Akoko, and that
Yes.
was where I have access to the best of medical. Even at presently now, it's
Yeah.
still far from what you can get in places like Akure or places like
Yes.
Lagos.
I get it.
Yes,
I get
so
it.
it's a rural community.
So now when you even check 15 years ago, 20 years ago, all right, in this same community, it could have been a lot worse than it is currently.
Yes,
And those labs that were doing those tests were also in this community, and the results were coming out as AA. That means for all the period you were receiving blood transfusion, they were also
yeah.
giving you AA blood.
The thing is that most hospitals, most private hospitals don't have lab like now. Every hospital has their lab now. But then there was this particular there's this particular center that
Mm,
runs a lab. The general hospital has their own lab, and a lot of people that run private hospitals, they use this particular lab. So we go to that lab to run most of our tests, right? It's a private lab, private owned lab. So I think the last one that I did, the last test that I did, was actually run from the lab of the hospital, the one that came out at Sickle Cell. So the
mm,
previous one, we have been running it from that private lab,
I
right?
see. And that draws me to something very important right now because in some of our previous conversations on this platform, we've talked about people who have genotypes and then they tell you it's changed. I went for prayers, it's changed or things like that. And many of those things happen in places where there is false positive, false negative results based on poor technical skills, poor reagents, poor storage facilities, and all these things make. I feel so sad to have like to hear this experience. And I'm imagining because for all the period we were being transfused with blood, if they weren't getting the genotype correctly, how are we sure they were also getting your blood group correctly? Because they could also have been giving you blood types that wasn't proper for you. And those things will even be giving you worse reactions or what we call transfusion reactions that is completely unpleasant. Do you want to talk about it a little?
In fact, you see, when you mentioned this, I realized that when I was young, I have series of blood reaction during blood transfusion processes and all that. So when those things happened, I think they used to give some injection, stop the blood completely, and that's one thing that made my dad to become a sole blood donor for me. And because of those reaction to different kind of blood that we do get outside, so my dad make it something compulsory that is the one that kept donating blood till I was adulthood, and then I stopped having those frequent blood transfusion. So for close to 10 years, my dad was the one regularly donating blood to me.
Well, let's move on to your work and the impact you've done for the past 30 years and more. Can you tell us about the Ignite Sickle Cell Initiative? What gap did you see? I know you've talked about the lack of access to information, and so far, what impact have you been able to make with your initiative, with your organization?
Ignite Sickle Cell Initiative, we've done a lot of impact, right? We've done a whole lot. And one of the one that is amazing is that we focus more on helping people with sickle cell in the rural community. One of our core mission is to reduce child mortality caused by sickle cell in rural community. And why do we have a lot of child mortality when it comes to sickle cell? We have late diagnosis, we have lack of access to information, lack of access to early interventions, and the like. So, what Ignite was able to do is that we've been able to do an outreach to about
About
15 communities,
communities.
right? 15 communities where we talk about sickle cell, and each of our outreach we diagnose for children, mainly children. We focus on children between 0 to 12 years. We
Okay, so sorry for that glitch and interruptions. We're fully back here. So, Kemi, you also founded the Sickle Cell Academy. How is it helping parents and caregivers to manage sickle cell at home? What are you doing?
I started Sickle Cell Academy from because of the results we have gotten from the sickle cell Ignite Sickle Cell Initiative, right? Because when we started working in Ignite Sickle Cell Initiative, we started educating people, parents, people with sickle cell, and all that. Then at that point in time, we were not getting the results we are supposed to get because we focus mainly on the patient, people with sickle cell. We started teaching them. Then realized that there is a gap because I can teach all I want and said, you're supposed to drink enough water. You're supposed to eat balanced diet. You are supposed to do this. This is emergency. When you start having these symptoms, go to the hospital. But the people with sickle cell are not the one making decision. They don't have the money. They are not the one that make the right decision and every other thing. And that was the gap we are seeing because we are putting a lot of effort in educating, but we are not getting the the results. So we decided to change our methods and start teaching the caregivers. And after we started teaching the caregivers, the result was amazing. Like the number of people that go to hospital increases, the number of people that go back for their checkup increases, the usage of their medication, routine medication increases. So we are able, their crisis reduces with a lot, like reduces. In fact, I published an abstract on that, the triple effect of caregivers education, right? I published it. So it was we started getting results, and because of that, we were thinking that how do we ensure this result is not limited to people in the rural community alone? We want to extend it to other people. And because I'm always writing about sickle cell management, I started having a lot of people coming to my inboxes. How can I manage my child with sickle cell? What do I do with my child with sickle cell? And because of that, we that was exactly what prompted us to started the Sickle
Academy.
Cell Academy.
Academy. Amazing. Amazing. Kemi, you're really making a lot of impact. I hope you don't mind sharing the link to the abstract you wrote so that we can put it in the comment section or in the description of this video so other persons can also get access to it. Okay, thank you so much. Now, you've also partnered with government and some international organizations, right? So, what have you learned about getting these big systems to give attention to the voice of the people who are most affected? Has it been so easy or is it so difficult to get this to work?
Um, I won't say it's easy and I won't say it's difficult. It just takes consistency, right? We have a partnership. Ignite Sickle Cell has a partnership with Ondo State Contributing Health Commission that enroll our people with sickle cell under the free health insurance in Ondo State. So it means that when you are in Ondo State and you are registered under the Elera Loro scheme, you are able to go to the hospital when you are in crisis and your bill will be paid by the government. So it means that all your treatment will be paid by the government. And then when I started advocacy for that, it was 2001, the first time I wrote a letter and said, we would like to get involved with this. When we actually got it was last year,
2001.
2020. Yes, we started 2001 and we got the result 2024. Why? Because government, it takes a lot. The first time we had that conversation, they said they didn't have enough budget to take people with sickle cell, but we kept in touch. And 2024, they were the one that actually reached out to us and said, we think we have enough money to be able to take people with sickle cell, right? So for me, I think it's important for there is little you can do as an individual NGO. Every everything that you want to get results, there is need for partnership with the government because they have the system. They have they have the system already, they have the network, they have everything, they're already well connected. So if you are trying to solve any challenges when it comes to health, you need to work together with the government because from that you start doing. They are the one that will make the policy, they are the one that will do all that, but it takes effort, it takes patience, it also take consistency. You have to be consistent. There will be change of government, there will be change of directors, there will be change in all of these things, but as long as you are consistent about it, you will definitely get results.
Amazing. I so much feel like I'm praying on the state right now and giving you a really good hug. You've done amazing, amazing, amazing. Thank you so much. I just hope somebody else somewhere is able to watch this and extend this initiative to other states. Thank you so much, Kemi. Let's move forward to something a little more practical and insight for families. For parents who are raising a child with sickle cell, so just make this very quick because I want us to just quickly wrap up. Give me three key things, three top advice you give to every caregiver on the day-to-day care that they should give to a child with sickle cell.
Mm. For parents that have children with sickle cell, the three key things I'm going to say is that number one, pay attention to your child's health. You need to study that child because the child is the one that lives with sickle cell. A little change in their body can miss a lot. So when you study them, you can easily pick it up, even though when the child is trying to hide it. Because one of the things that a lot of people don't know is that people with sickle cell hide their symptoms because nobody likes to go to hospital every now and then. So most times until it becomes big, they hide. And when you can see that small symptoms, you can easily manage it. The second one is, I would say, support your children with sickle cell emotionally. We often focus more on the physical aspect, but sickle cell has its own emotional side. So it's possible when somebody go through bullying, when somebody go through stigma, when somebody lost their relationship or lost their job because of sickle cell, the impact psychologically and emotionally is high. So I will say that invest in the emotional side, invest in it. So, and the third one is that believe that child, your child can be anything, and you need to support them. You know, most times parents decided to see sickle cell before they see their child. So I want you to be able to see your child before you see sickle cell. Your child is human first before sickle cell. So what does that mean? It means that your child is going to have aspiration, like that child that doesn't have sickle cell. Your child is going to have the ambitions. Your child is going to have whatever they want to do on earth. They have purpose that they must fulfill. So your goal is to support them to achieve all that. And how do you do it? You have to do it by seeing that child without before seeing the sickle cell. When you see the sickle cell, you stop everything the child wants to be on the excuse of the child living sickle cell. So if the child said, "Oh, mommy, I want to become a doctor," and you are seeing sickle cell, you see that people with sickle cell cannot be, it's too stressful for you, it's not something you can do. Look for something simpler. That is you writing off the child based on sickle cell. So but when you see the child, you understand that there's something about this child beyond sickle cell.
Amazing. Kemi, you're blowing my mind. Like you just, if you see what's going on inside my brain right now, the fibers are firing left, right, center. This is amazing. Amazing. Okay, let's look forward and into the future and maybe ask you a couple of questions. Now, Kemi, if you could change one thing about how society approaches sickle cell, right, today, what would it be?
Oh, if I can change one thing about how society approach sickle cell, it would be to see people with sickle cell as normal as the other people without living with sickle cell, right? The stigma with sickle cell in our society is extremely high. People will judge you for living with sickle cell. People will see you as not human enough when you live with sickle cell. And this thing affects everything you do. You go to work, and then people believe that you cannot deliver because you live with sickle cell. So if there's something I can change, it would be that inclusion, that acceptance, that seeing people with sickle cell as normal as the next person. Yes, sickle cell is just a disorder, just like any other chronic illness outside there. So when you see it as not so big deal, then we have more acceptance into it of people with sickle cell. And then we also give them a soft landing, right, in the society. So it means that they have equal access as people that doesn't live with sickle cell. So if that's something I can change, either maybe policy or another thing that gives people with sickle cell soft landing and more acceptance into the society.
Amazing. Let me ask you another question, Kenny. Now, for you as a person, what keeps you motivated for your personal work beyond the Ignite initiative? And particularly, what motivates you at the moment where you are most ill, maybe from sickle cell or something related to it?
One of the things that drive me is the results, the impacts. Most times, sometimes I'm tired. I'm tired because there is so much challenges you have when you are solving problem like sickle cell, especially in a society where there is no funding for sickle cell, there is no kind of support for sickle cell, and then you kept getting a lot of no's and all that. So one of the things is that my focus is not just to have people with sickle cell that survived. My goal is to ensure that these people thrive. And every time I got testimonials and said, "Oh, do you? I'm now in school. I have gotten admission." All those things, those positive messages, they are the one that keeps me going. It makes me to feel like, oh, we are getting results. We are changing lives. These people, imagine I'm not doing what I'm doing. It's possible for this child to remain and not be able to go to school. Because every time I have parents that comes and say, "Oh, my child gain admission to university. I don't want him to go because of," that's some of the things I feel. And because of me, or because of my story, or because of what I do, the child is able to go to school, get work, save, be able to realize that there is more to their life than sickle cell. Those are the things that keeps me going.
Amazing. We have another doctor who is going to join us on this call once Kemi is gone. His name is Dr. David Owoeye. He's a sickle cell warrior himself, and he's a medical doctor. He's heading some ministry activities in Saudi Arabia and a Nigerian, and he's a specialist in disease prevention and control. And this is your story as to how every individual has rights to their aspirations regardless of gender, regardless of maybe some genetic conditions like sickle cell and all of that. And today I feel so honored. I feel so I feel inspired by what you're doing, Kevin. And I
Thank
really
you.
wish one of these days we'll have the opportunity to meet in person. Your journey is such a powerful one, and it reminds me truly of the problems that exist so true and so real, yet when you share them, they appear as though they're novelty. I can't imagine that for 18 years, no proper diagnosis was made. I mean, I could imagine all the thoughts you had in your mind. What's wrong with me? I mean, and I'll close with this, which is one of the things you said, which is very touching. When people who have sickle cell disorder going through their crisis, sometimes they want to hide it. I have a friend who lost his brother to sickle cell, and in their last chats,
How are you doing? I'm good. Work is good. Okay, I'm going here. But he was saying that lying on a sick bed in the hospital. He didn't want to involve the siblings or tell the mom or tell the parents. He felt he has been a lot of trouble to them already. All right. And then on the other chat with a friend who was closer to him, bro, I'm going through a lot of pain. I just hope God keeps me alive. So to the siblings post death, they're seeing these two messages. Just a second earlier, oh, I'm good here. To the other person, I don't know what's happening. And this is actually the kind of situation that people will go through if the environment that they are born into doesn't provide that safe environment emotionally that allows them to truly air themselves out and not feel
Yeah.
completely overwhelmed. And also to governments, because sometimes the guilt comes when you feel that your illness is preventing the rest of your family from really enjoying themselves. All the income is being spent on your welfare. You just feel like, let me begin to hold back. Let me not be the trouble in the household. But if we have this free and accessible care in hospitals through partnership with government and organizations, philanthropists, you know that families can easily access help for their babies and for their kids and for their children without having to shoulder all the burden from their pockets. Kemi, thank you so much for being here. And I don't know if you have a
Thank you
last
for
word.
having me.
If you have a last word for anyone who is listening, especially the child who is out there listening to us, do you want to say something to inspire someone to pursue their dreams?
Okay, if you're somebody that lives with sickle cell and you are listening to me right now, I want to tell you that you're amazing, right? Because I want you to see beyond sickle cell. You're amazing, you're good, you're smart, you are everything, and you can be anything you want to be. So, irrespective of what, yes, dealing with sickle cell is hard. Dealing with sickle cell can be annoying sometimes. You just feel like, why am I dealing with this? But beyond everything, you are amazing. I just want you to be able to see that good side of yourself, the amazing side, the brilliant side of you, and be able to use that.
Amazing. Thank you, Kemi. All right, guys.
Thank you.
And we'll be taking
All
her
right.
leave right now. And we're so glad to have you. And hopefully, not next year, we'll have a community of health advocates who are pushing on maternal and child health. And I hope one of these days you'll be able to drop in into the community and just share one of your tips with all of us. Until that happens, thank you so much and God bless you,
I
Kenny.
do. I do. All
All
right.
right.
Bye.
Bye. Thank you so much.
Amazing. I know many of you have things that you would love to ask her. So we're going to make the communication open. Kemi is going to be a part of our community for the next couple of days in the WhatsApp community, and you get the opportunity to ask her questions, connect with her, connect her to connect families that may benefit from the advocacy that she is running with our organization, and we'll do that for the next couple of days in my family companion community with my Medical Women's Association of Nigeria. All right, without taking much time, let us switch right now and get to listen to Dr. David, who is joining us all the way from Saudi Arabia.
Okay, so ladies and
Okay,
gentlemen,
I'm good
we're
to go.
excited to have Dr. David in our midst. And ordinarily, I would make an introduction, but I don't want to do that. Dr. David, please, can you tell us who you are? Can the people get to meet you?
Okay, my name is David Owoeye. I'm a medical doctor. I have sickle cell anemia, hemoglobin SS, and I am an advocate for sickle cell disorder. I'm an author. To God be the glory, I've published 4 books. I've co-authored 1 book, and I specialize in infection prevention and control. Currently, I'm working in Saudi Arabia with the Ministry of Health of Saudi Arabia.
Amazing. So you wear a lot of hats. You're a dad, you're a physician, you're an author, and you're also an advocate. Can you tell us how has these experiences shaped your view, all right, of patients and the healthcare, especially being someone that has the hemoglobin SS?
Okay, being a patient with sickle cell anemia, and the experience I've had with health workers had made me to understand better that we need to do more of listening as health workers. Because sickle cell disorder is a condition whereby there is limited information, not only in the public, but within the health sector. In fact, for me, there are a lot of things about sickle cell disorder that I did not know until I started experiencing them. I graduated from University of Ilorin. Nigeria has the highest population of sickle cell disorder in the world. So I thought I knew so much about sickle cell. But when I reached the age of 40, I discovered many things. And when I tried to reach out to other people with sickle cell disorder globally, I discovered that they were experiencing the same thing. They tried to talk to their doctors. Some doctors wished us did not agree with what we are saying, or was telling them that maybe it's because of some other factors. For instance, a condition called chronic fatigue syndrome. When I discussed with a colleague as well, she was like, maybe those things we used to put under the umbrella of somatization. Maybe some of them were indeed chronic fatigue syndrome. Because for chronic fatigue syndrome, you have to do all necessary tests. I did a lot of tests, thyroid hormone test, echo, ECG, lipid profile test. I did everything and it was negative. It was normal. Then the hematologist said to crown it all, I should do vitamin B test. And when I did vitamin B test, it was normal also. Then she agreed that actually then this is chronic fatigue syndrome. So we have conditions like that. And when I've had people with it speak, sickle cell warriors with it all over the world speak from Australia to America to Canada to Zimbabwe, Zambia in Africa and other African countries, even here in the Middle East, they mentioned the fact that they tried to explain this to their doctors or physicians or hematologists, and they did not get to understand it, and so they kept quiet because nobody is listening to them. Even to their family members, they just like look for something to explain it away. And I now understood better why sometimes they will keep quiet. If you are outside to what they are experiencing, you will have said if you continue talking, but if you're experiencing it, you understand. Chronic fatigue syndrome is a suffering, not just an experience. The energy to talk, the interest to talk, when you finally summon up courage to get the words to say, it costs you a lot. One of the things about it is that the fatigue, chronic fatigue, is not like every other fatigue. You have a chronic fatigue, it just comes suddenly, like a pain crisis comes suddenly. And then you go and rest. And by the time you wake up, you feel weaker. It's as if you carry a bag of cement or stuff like that. And you don't really understand how to say this. So, look, being a patient with sickle cell disorder, I have come to understand that as health workers, we need to listen more and not try to project our own idea or our medical training on what the patient is saying. For pain crisis with sickle cell warriors, if I'm not a sickle cell warrior that have experienced pain crisis in many occasions, I may not be able to understand that pain crisis with sickle cell disorder is worse than labor pain of a woman in active labor when our cervix is fully dilated. I will not understand that it's worse than that. I've interacted with women that are giving birth to children that have sickle cell disorder. And then some of them told me that during the experience, the nurses were like, "Are you sure you're in labor?" And she said, "Yes." But that she's trying to maintain her cool because she doesn't want the stress of labor to generate, to trigger a pain crisis, because that is the worst of all experience. And so many of them have spoken out that I've heard someone say it's 10 times worse than labor pain. For me, I could describe it like the pain somebody having when he has multiple bone fracture in different parts of the body. Because at times, like all your bones are breaking. Other times, like they are putting nails inside your bones. And every part, the interesting or the unfortunate thing about it, wherever it starts in the body, is to aggravate to every part of the body. And then, as bad as it is, you can still feeling the pain in your nails, fingernails, toenails, and it could be shaking. That pain is horrible. At times, I could describe it like the pain of somebody with bone cancer. At a particular time, I started using petidine because the doctor that had bone cancer was using it. And I tried a lot of things, prednisone. I had to increase the dose of petidine sometimes. So when I now was able to get petidine, it was able to relieve the pain better than prednisone. And that's why I just got to understand that, this thing is just worse like the pain of bone cancer. So you will be able to understand these things better. And so if a patient with sickle cell disorder is telling me that he has pain crisis, I know what to do immediately because I know pain crisis is horrible. I won't have to debate. I know the basic things we're supposed to do. give the person intravenous fluid. I've had doctors that are saying, you don't need intravenous fluid. The other was in pain crisis. I was like, where did you train from? The basic thing is hydration, because the hydration will help you flush off the sickle red blood cell, and then give the strongest analgesic if you have. If I give the patient IV Adol and it's not working, and give him IV diclofenac, IM diclofenac, and it's not working, and I have access to give the patient tramadol IM or tramadol IV, I will do it because I understand. I won't tell the patient that just enjoy it for a while. No, no, no. Because I know how horrible that pain can be. And if I have access to be able to give a patient that person, I will say amphetamine. Even after giving IV tramadol and it's not working, I will start it because I know how horrible the pain is. And then the pain messes up the mind. So which makes me speak about the other part of sickle cell disorder that the healthcare industry has not been able to look into properly. I was diagnosed with depression in 2019, and I was on medication for depression as because of sickle cell disorder. And when I had to reflect on the different occasions of things I've survived with sickle cell disorder, frequent pain crisis, underfoot syndrome, splenomegaly, later become autosplenectomy, often come with a splenic crisis, pica, eating of sand, chalk, and all those stuff, priapism, stunted growth, protruded abdomen. In fact, some people then were thinking I had kwashiorkor, but it wasn't kwashiorkor. So a lot of all these things, at each point, they were impacting on my mind. Not sure enuresis. I was bedwetting till the age of 10 years. And back in those days, nobody even knew that it was connected to sickle cell disorder. And the ideology that was prevalent in the society is that, if you discipline the child, or if you tell the child to go and spread its burdens outside, and the shame of it will make the child stop. I did that severally, those things were impacting upon my mind. So I saw that, there are different periods of trauma mentally that our sickle cell warriors will endure from the cradle, right from birth to the grave, because every of the crises and complications of sickle cell that we have has a toll on our mental state. Now, people with chronic disease, because sickle cell disorder is a chronic disease, also suffer from mental problems because of the chronicity and severity of the condition. So one area that the health sector has shied away from, not only in Nigeria, but all over the world, which we are now looking more into, which you started looking into now, is the mental health of people with sickle cell disorder. Most of us come down with mental health problems. I've had those who has anxiety disorder. I've had those who have some other new innovations in terms of describing mental health disorders or mental health illnesses. So it helps me to be able to know that looking at the patient holistically with sickle cell disorder, you want to cover every part, the mind of the patient. If as an hematologist, if you're a hematologist or you're a general practitioner, you immediately refer the patient, even if the patient does not think he or she needs it. Just refer the patient to see the mental health specialist and make the patient understand that I'm standing there with you. If you want me to go there with you, I'll go, because the ostracization or the stigma that most people carry all around the world, it's not only in Nigeria, but all around the world, regarding mental health illnesses. I come to understand that many people suffer from it. Here in Saudi Arabia, where I work, in Jizam, I've seen patients frequently having irritable bowel syndrome. And sickle cell disorder, I got to understand that also causes irritable bowel syndrome. I have irritable bowel syndrome, and I've also seen from literature that irritable bowel syndrome causes mental health problem. So I've spoken some patients when we were describing the way irritable bowel syndrome was affecting their mind. I got to understand that, these people have started having mental health symptoms due to irritable bowel syndrome. And I was trying to stop with somebody that we could get them referred to see mental health specialist. And the person was like, people have that stigma. They don't want to come out to go and see because of what the society will say. So you see that it's a problem for people to identify the mental health challenges they have and seek appropriate care. So being there for sickle cell warriors to listen as a mental health worker is something that I have learned. You will listen compassionately, you will listen empathically, and then you'll be able to take informed decision quickly. You will not think, the patient is trying to exaggerate, because you understand what it is like.
Especially because this is recurrent, it could get to a point where, in fact, let me put it this way. I know a family that has a child with sickle cell. The girl's mom is late. So she has a stepmom. The dad got married to someone else. And they would always say that she uses pain to get attention. So when she begins to have crisis, sometimes they won't take it serious. They'll say, we know what she's doing. She just wants attention. And with what you're saying right now, and I'm just trying to imagine it. If such a thing continues in her life and she begins, what the impact those things has in her mind, because at least one should believe when I'm in pain, people should come to my aid. But when it gets to a point where
Yeah.
you're even in pain and someone is saying that leave her alone, she knows what she's doing, it could just be a lot terrible. Let's move on to your work. You've gone on despite all these experiences to become a doctor, and not just a doctor, a specialist. Can you tell us what's the intersection between infection prevention and control? And is there an intersection between that and sickle cell? Was there any reason why you decided to go into that specialization?
Okay, going into infection prevention and control was a decision I had from God, and I followed that route. However, I've seen that people with sickle cell disorder, like other chronic diseases, have immune suppressed, their immunity is suppressed or compromised. Now, because of the compromised state of their immune system, we are prone to more infection than others. So infection prevention and control practices helps you to be able to prevent those infections. So when others are not taken seriously, putting on face masks in public places, I take it seriously. A sickle cell should take it seriously because you are more at a risk of infection than every other person. So all of those practices, and hygiene practices, cough etiquette, disinfection, and all of those things that you should do to prevent you from getting an infection, I will take it seriously because I know that my immune system is not as strong as other people, and then I want to reduce the risk of obtaining an infection or having an infection.
So this is important, especially for parents with kids who go to school. They will need to have a proper conversation with the kids, the teachers, to let them know that, I mean, if other children don't wash hands and sanitize after they go for playtime, it's important in this child. Like you mentioned, for some people who are listening and the medical terms we are using, let me just try to numb it a little. When we say someone's immune system is not optimized or compromised or whatever we say, we simply mean that for an individual who doesn't have a chronic condition like sickle cell, all right, they have a stronger immune situation. So if they're exposed to what ordinarily should cause illness in them, they may not come down with that illness compared to when someone who has a low immune state. So let's put it this way. Ordinarily, you could lift a bag of cement for someone, and then another day you are not feeling too well. You can't lift that same bag of cement. That is exactly what it is for an individual who has the sickle cell. Their immune system, ordinarily that should be up here, is a little down here. So it's now become very important that they become more careful about their health. They should be more careful about the exposure to even ordinary things that others wouldn't take so serious. Like I know for my child, because I'm a medical doctor, I know, and being in the clinic, I've seen that you see women who come in and they tell you, my child has malaria, and then you ask, do you sleep under mosquito treated net? They say yes. And then over time, we began to realize that the mosquito that bites when the children are still in the parlor playing in the evening is even worse than the mosquitoes that don't assess those kids when they're already sleeping. So most parents are careful about when they sleep.
Mhm.
I don't know, from 5 p.m., 6 p.m., some doors are still open, some windows are still open. Those times, those kids are still
Yeah.
exposed to that. And this becomes more important in kids or in adults even who have sickle cell anemia. Doctor, let me ask one more question with respect to your work and your advocacy. Now, you founded can you tell us, about your work with Buella Sickle Cell Foundation and then the
Yeah.
Amplify Sickle Cell
Brothers Sickle Cell
Voices International?
Foundation voices. Okay, no, I didn't find. I was not. I'm not founder of both. Brothers Sickle Cell Foundation was founded by Mrs. Josephine Olunike. She's in Abuja, and then she reached out to me. Cousin is a medical doctor, my colleague, and then when she started, she said she was trying to get in touch with somebody. She wanted to know somebody that could help in the foundation because it was like a ministry God gave her. And then she was trying to seek people that can walk the same vision with her. And then my colleague who is her cousin, because he knows I have sickle cell anemia, and then so he said she should contact me. Now, from my own story, she said it took like almost 2 years before she could contact me because people can be really horrible. People who want to make money from foundations that take care of less privileged people, like Sickle Cell Foundation, to show that they are doing something. Now, and those people are calculating if you are getting 1 million, it will be 20%, 30%, because what they are interested in is the money. So she said she didn't want to have such people. That's how she took her time to pray. And she said God told her that she should she should come and meet me, that he has prepared me for the work. When she told me that, I did not argue about it because I knew right from onset what God told me regarding sickle cell while I was still a teenager. But now looking back, I just thank God that God is using me to be a voice for many people so that my experience can inform and inspire many people. So she was able to reach out to me, Build Sickle Cell Foundation, and made me a trustee, and I still work along with them. Also, Amplify Sickle Cell Voices is founded by a woman in Australia. She said she just saw my advocacy on internet, especially social media. And she said, who is this person? Who is this person that? Because consistently she sees my advocacy. And most of the time I use my experience to speak about sickle cell. And then she was like, the way people experience it is what I'm talking about. So she reached out to me, and that was how we discussed. And I said, I'll be happy to be part of it. And then I joined. So it was
Amazing.
just God putting me in a position that He wants me to serve.
Amazing. And Doc, I spoke with Kemi. She lives in Ogun, if I'm correct. So Kemi had sickle cell for 18 years and never knew. In fact, the blood type she was given was AA. So for those 18, in fact, they had done over 3 series of blood tests, and each of them kept labeling as AA. So when the symptoms or the things that were happening were not consistent with, her blood type, she was labeled a witch, she was called all sorts of things. It was when she was then in the university where she had achieved a level of independence that she went by herself to a government hospital and had another test. She said she was even happy to see that finally there's a name to what is happening to me. Because all this
Yeah.
while she was worried, like, why am I different? Why am I a burden to the family? Why am I a trouble? Why? I mean, so she was even happy to know, okay, this thing I'm going through has a name. And she went on to begin to do a lot of advocacy. And when I look at her work and I look at what you have done too, I see, I see the fact that being a doctor makes that when you communicate this, it's beyond just the advocacy. It's on a it is deeper with insights, right? Like the things you brought to the surface that ordinarily the medical text may not show us this. We don't have a lot of literature that highlights these things. But with the mind of a doctor and the experience of a patient, you're able to put these two things side by side and begin to bring some things to the surface. And that's why I want to talk about the thought. You've written a lot of books, all right? And I hope the medical community will humble ourselves and look into the perspective with which you are presenting this thing. Can you tell us a little about it, from the memos to the poetry to even the book you have on malaria? I can see that behind you. All right. So which one was the hardest, and which one will I say, is the most meaningful to the cause that you have been advocating?
Okay. The first one, in life with sickle cell anemia, was like the hardest. At a particular point, I felt I'm going to give up. Yeah, and I was like, it was because that was during the COVID-19 pandemic, and I was involved with my work here in infection control. Though I was in Nigeria, and I got caught up in Nigeria during the lockdown. And at the particular point, I was also working with the NCDC, Nigerian Center of Disease Prevention and Control. On the national level, we are having online most of the time meetings, like 3 times in a week, so as to know how Nigeria could manage COVID-19 emergency, the pandemic properly. So I was giving my own expertise in the area of prevention, and control. So all of these things, and then there was the responsibility of children still doing online schooling. So parents had to be there for their children. And then there was the plan by the Saudi Ministry of Health to evacuate their doctors, Nigerian doctors, back to Saudi. So a lot of things were there going on. And at the same time, I was working on the book. And it was like, sometimes it was just overwhelming. I had been diagnosed with depression a year ago. But then I didn't understand some of these things in terms of being overwhelming. Now that I understand depression better, I can say it was overwhelming. It gets to the point that when so much things are, for somebody with depression or mental health problem, when you have a lot of responsibility and each one is making demands on you, it could become very overwhelming. As if at times you feel like you are drowning. And if you're not careful, you could just spark out that, oh, what's all this on? And I've experienced it frequently now because, and then from my experience of it, I can better advocate about depression and mental health to people also, that when strikes are getting too much for you, just put a stop and calm down, withdraw from everything. So that helps me to make decisions. I don't commit myself to anybody or anything easily. In fact, some people are reaching out to me. In fact, I made it an intention to prevent or protect my mind. That people that ask me questions personally or from my social media, I hardly respond to their questions because I cannot sustain answering to many people. Sometimes I write publications, maybe publications or posts or poems that I wrote like 6 years ago. Somebody is still seeing it today and making comment that, oh, I woke up this morning and this was the message that inspired me. And so people now many people reach out to me on social media privately. Why I cannot. Initially, when I started, I saw that it was too cool, so I just had to stop. So that period, I was getting so overwhelmed. It's as if I was just throw out the toilet and say enough of living and enough. So it was very tiring. When they say making the first million is difficult. So in that same sense, publishing the first book was that challenging, that overwhelming. And I thank God for it because God wanted me to be thorough about it so that I could relate with the medical profession. So I did a lot of research regarding it, and I was able to put the references properly and ensure that it was like a book that everybody could read, but also like a scientific book that people can learn from. So that if you are seeing footage, so I was able to marry together the experiences we have and what medical literature says about it. And so when somebody wants to argue with it, when you see what the medical literature is saying about it, you will understand that, okay, it brings out the
Science back.
evidence to what we are, yeah, scientific facts to it. So that took me a lot of energy. Sometimes I would have written and God would go back. No, it should not be something like this. Go and write something. Go and read more to be able to bring out something that is scientific, whereby people in the health field, medical field can relate with. Because some people will not want to read it it's just your experience only. But the experience back up or corroborated with scientific facts. So it was really tiring because I had to go do a lot of searching to be able to ensure that whatever I'm saying was backed with evidence.
Amazing. If someone wants to get these books, like how can people access it?
Okay, it could be gotten on Amazon, on Seller, and then on some Nigerian bookstore. Roving Heights is in Roving Heights in Lagos, in Abuja. And then the publisher, that owns, I've forgotten the name now. One of the symptoms of chronic fatigue syndrome is short-term memory loss. So I've forgotten Bloomberg. Is it Blue? No, not Bloomberg. Sorry. I've forgotten the name now, but I'll reach out to you. One the publisher that put it in different bookstores. But you could also Dr. Ifeanyi, she could help you out to be able to get
Amazing.
some of the books.
Why I'm asking is because we're going to get the links and put them in the description in this video so that there's a statement you made which resonated strongly with me. In this book, My Family Companion, which I wrote, um, there's a line of statements you used that immediately resonated with me, which is you wanted to write something that could connect with the ordinary non-medical person, but at the same time, it is so scientifically backed that even that the medical community can also take a lot of material and data out of it and all. So, because many people who are watching this right now, beyond these few conversations we're having, they need to have the information, they need to know it. And one of the things that knowledge does is when you know something, when it begins to come, you won't interpret it wrongly. Because the moment you are going through an experience and you don't even know that this is what you are going through, all things being equal, every remedy you be taking or every action you be taking may be contrary to what you actually should be doing. Like the depression you talked about. Somebody who is living with sickle cell may get into serious depression and may consider it something else, not knowing that this build up over the years, like Kemi that I spoke about, she said something that she went to a hospital. She received 3 units of blood over a 2-day interval. Then the next week she came back and her PCV was 21 or 22. And that the matron in the hospital told her, go and tell your people that are sucking your blood that your family has tried. She said, like, even if the people on the streets should say this, how would a matron in a hospital say that to her? And when all these things have piled up in her heart, if not that she's someone vocal, and do you know she has single-handedly with her organization gotten the government of her state to provide free health care to every person who shows up in the hospital in their state on account of sickle cell crisis or anything. And she says she has been promoting, she has been pushing for that since 2001 and got it in 2023. 22 years she has been pushing for this singular stuff. So for someone like her, she may not so much go through a lot of these things we talked about, but there are other persons who are suffering in silence. And it's really, it's well. Doctor, don't forget, we're going to get the links from you. You want to put it, and I'm inviting everyone, especially families or families with kids who have this, they need to know this and they need to read it. And even if you're an adult who have this too, you want to also read it so you know how to navigate your life a lot better. Okay, so let's get to the next questions. I want to move quickly to getting from your wisdom practical things we want to share with people. Now, many people who live with sickle cell wonder if they can thrive in demanding careers. And I mean, I went to medical school and I can tell that it's really a very demanding academic requirements. The rigors, the night classes, the clinics, the standing, it's just so much. Then after that, you get into the training itself, you realize that the medical school was a joke compared to the practice itself. It's a whole lot of difficulty. But despite this, you've been able not just to survive, but to also thrive. What do you want to tell people who have sickle cell or parents with children who have sickle cell about the ambitions of their kids? How can they navigate this?
Okay, I'm going to use 3 quotes to explain it. The first is this: the presence of sickle cell disorder in our blood is not the absence of God in our life. The ability of God to thrive, to succeed in life, is not taken away from us because we have sickle cell disorder. God has given it to every human being, and God did not take it away from us because we have sickle cell disorder. So the ability to thrive and succeed in life, you still have it. Do not allow sickle cell to make you blind your eyes to that. So understand that you can succeed. The mindset must be prepared to succeed. And so you need to make yourself understand that you can still succeed even with the challenges of sickle cell disorder. You can still thrive. even with the challenges of sickle cell disorder. So that will take me to the second quote. By the grace of God, there are no limitations in life except for the limits you form and allow in your mind. If you want to succeed, you have to prepare your mind not to limit yourself. Once you start putting limit upon yourself mentally, it will affect you. People may put on limits. People may tell you, oh, no, we don't want you on how to do this. But there's this thing that they say about us with sickle cell disorder that we tend to be stubborn. Even when they want to stop us from engaging in vigorous exercise, we want to do it because we don't understand why we should not do it. And then we suffer guys at the end of the day, and we still go back to it. The point is that your mind is not accepting no. Your mind is not accepting no. Now, that has expanded your ability to search, to pursue things in life, because you know that the presence of God in your life is not taken away because you have sickle cell disorder, and then there are no limits in life except for the limits you form in your mind. So you're not allowing your mind to limit you. Then the third quotation is that know what works for you, know how it works for you, and make it work for you. Now, know about sickle cell, and now you need to take care of it. Know the triggers of sickle cell disorder: dehydration, extremes of temperature, infection, stress, either mental or physical stress, hypoxia, and the rest. Know about those triggers, and as much as possible, try to prevent them. Once you try to prevent those triggers, it will reduce your chances, it will reduce the chance of having sickle cell crisis, which can interrupt your work or disrupt your work. Now, know the things that work for you. All your medications, please use it. I use all my medications. Go for all your clinics. If you are referred to a specialist, which is not an hematologist, please go to those clinics. If they prescribe medications for you, use all those medications religiously and routinely. That will help you stay healthy, because you need your health to be able to be productive. A healthy the population, they say, is a productive one. So it has to be productive in your life. So you have to use all your medication. Now, other things aside your medication, aside the hospital visit, there are things you've seen as life skills that you have been able to adopt for yourself. Know those things properly and know how it works for you. Once you know how it works for you, then make them work for you. So in terms of studying, for me, I understand that I'm a fast reader. I can read very fast. So then the point is that after reading the first time, I may just absorb maybe 30% of what I've read, but I'm a fast reader. So a topic that other people are reading once, I can read it for 5 times. So right from the onset, when we start a semester or a session in school, I've started reading, because I know I will have to cover this maybe 5 or 6 times when others are reading it just once. And because I'm a fast reader, I also read anywhere. Apart from being a fast reader, I understand that I can read anywhere. One thing I just have to do is focus my mind on what I'm doing. So in the taxi, I can read in the taxi. Where people are in a reading class and they are shouting, I can read and concentrate there. I can go anywhere. I can carry my book there, even at home, in the kitchen. So I use those skills, those ability, those potentials in me to make studying and my career better. So some people may be that they can retain information very quickly, or they can absorb so much information within a very short time. So what they need to do is that they should expose themselves to more information. The more information they expose themselves to, the more they retain, the more they absorb, and the more they know. So understand those things that can help you to be able to succeed, those skills, those talents, those potentials in you that get you to succeed in a particular career, and then start making those things work for you. See how you can, structure your career, structure your academic, such that those strengths you have will be able to amplify your successes. Thank you.
Amazing. Thank you so much, Doctor. I want to add just two more things before I let you go. I know I've taken quite much of the time in the conversation. Um, the situation we have right now is different from what it used to be years ago, because not the science have so much. Yes, science have improved, but I would say that knowledge have improved. So back in the days, the stigma associated with sickle cell was so much. There were a lot of labels on people. Right now, from my experience, I see that stigma shifting to sympathy. So people no longer have stigma. Though yes, there are still some ways where in the job place, right, in the marketplace, some organizations they may not put it directly to someone's face, but they look into such things to even determine if they'll take someone, and those are discriminations that are actually very wrong. So this transition from stigma to sympathy, how can you advise first individuals who are already adults with sickle cell, and then families with younger kids who are coming up with sickle cell? How do you advise them to navigate that experience to maintain their identity and thrive in society?
Okay, one of the things I would say is join a sickle cell organization or a sickle cell group. From there, you will learn about other people's experience on how they manage or navigate this, because maybe one person, particular person's experience may not be sufficient. When you hear their story, here is a place where you get a sense of belonging. You hear parents who have children with sickle cell there, and they're explaining how they navigate their school, what they tell them in school. You must be able, as a parent, if you don't have sickle cell anemia, but your children have sickle cell disorder, you must take their health like your health and speak out. So the way you will carry your health, what is precious to you, that's the way you should carry their health. And so fight for whatever may want to attack it. Fight for whatever may want to hinder them. Fight for whatever may want to trigger a crisis. And then ensure you are in the front line for them to speak about it, to be able to get. Actually, what we don't want is sympathy, empathy that will make people act appropriately. Be able to get from people empathy that will make people act appropriately. Speak out for your children if they can't speak out for them. But for an adult, you have to first of all learn to listen to them. When you learn to listen to them, you're able to speak out for them. Because over the years, one of the problems we've had is that most of the people talking about sickle cell disorder are not talking from the experience. They're talking about what they want to say. And it has become a problem that we now that we are sickle cell warriors talking about it, we say it in the way we want, the way we feel it, the way we experience it. And even sometimes, because of the religious background some people have, or social background, they're like, no, don't say such negative. I'm a Christian, and I'm quoting scriptures, and I'm telling you that I have depression and I'm on drugs for it. They're like, how can you be claiming negative for yourself? Excuse me, will you shut up? You don't have to agree with me, but I don't need your opinion. So as an adult, you need to make up your mind that, see, it is your own opinion that you shape your life. One of the ways I've been able to navigate that part is this: God did not create me and send me to this world to waste my life to live by anybody's opinion. So it is God's opinion about it that I care about. So if God is telling me, use your experience, use your medication. In fact, because initially, right from childhood, I was not using my medication until God told me that I have to start using it. And He said, I cannot be using you to talk to other people with sickle cell disorder. They need to use their medication. I cannot be using you to talk to other people with sickle cell disorder about the need to attend their clinic and hospital visit when you do not use your medication, when you do not attend your clinic. Because if I do, it will make you an hypocrite, and I do not work with hypocrite. So I think it was from 40 years upward that I started using my medication. Even when I suffered crisis back then, as small as folic acid, I was not using it. Maybe I would just use it short briefly because I have crisis, and afterward I would just discard it. So now I am using it. Every medication they use, I'm using it. So I have an instruction from God. That's what I'm living by. And if somebody is saying, why are you confessing again? I'll just tell him, shut up. I don't need your opinion. I was not created by God and sent to this world to waste my life to live by your opinion. So I don't care what you think. I don't care what you say. I'm using my education because when you suffer the problem, those people's opinion will not do anything for you. So own up, health promotion talk about owning your own health. Own your health and then do what is good for your health. People will pass away, their opinion will pass away. They will not be there when you are going through this problem. So do what you need to do for yourself. Protect your mind from people that are toxic. And so it means your people you allow in your life, you keep association with. That's why I said join a school cell group. There you have people of like mind that share the experiences to improve one another. Not somebody that you talk about your experience to and the person is stigmatizing you, and the person is laughing at you. I remember a webinar I had, and a nurse was working in an European country, was talking about his experience with his colleagues, that when he experienced priapism and was telling his colleagues, they were laughing at him. These are health workers who should know that priapism or people said disorder. I was telling them that he had it, and they were laughing at him because they thought that that day was just keeping, he was staying quiet. That thing is horrible. The kind of pain a woman labor pain has is the same kind of pain. But the only thing is that the pain is occurring in the penis. And so they were laughing at him. So you have people even in your field that you expect that they should know better and they are behaving otherwise. It means those people bring some form of toxicity towards you in their behavior. You need to reduce your exposure to them. You have to protect your mind. Thank you.
Amazing. 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 Thank you so much, Doctor. The last question I have for you, looking ahead, and I want to draw some inspiration from you. You are a dad of two boys, two amazing guys. How has being a father influenced your advocacy and your writing, your sharing? Before you became a dad and after you became a dad, did anything change? And can you tell us about it?
Even right back then, because I didn't understand what God was telling me to do, I was not into a lot of any advocacy. I was not talking about it. It is in my early 40s that I just had to like revisit it. God made me understand that I had to revisit it. And then I apologized to God for not doing anything about it all this while. And I started doing it. So being a father, I was not even talking about it. The only thing is that the little information that people should know, I share it then. Or if somebody should refer someone to because he knows I have sickle cell disorder, I can speak to them about it. But coming out publicly to talk about it, I was not doing that then. Now, before I started speaking about it publicly, I first of all consider what it will do to my family. It may bring them to the open light, probably, because I'm talking about my experience. And then to make, sickle cell is not like, you see on social media, people bringing up positive things about their life. Oh, I bought a car, I bought a house, I achieved success, I got a new job. But sickle cell disorder is not like that. I suffered from PICA, I suffered from deep pain crisis. Talking about PICA, you have to talk about your penis. It's a private part. Well, in that private part, you have a pain, and I have to share it. And I was like, how will my family feel? How will my people that consider my family? Or I knew that it is a task from God I have to do. So I just asked God for the strength, and God should guide me. God help me to do it right and protect my family. Because I know that every experience I've had and I'm still having, I have to share it. That's why God allowed me to have it so that I can use my experience to inform and inspire others so that others will not suffer the things we have suffered. So anything I'm experiencing, whether they are new things or old things, I'm sharing it. Because in fact, when I share it, I still get relief. There was a time I was going through the chronic lower back pain of chronic early spondylodegenerative changes of the vertebra. Sickle cell disorder caused it. When I was diagnosed of it, I saw the neurologist and they said, neurosurgeon neurologist, they said, no, the only thing they know that causes it is age. But when I relate it with my hematologist, he said there are two things that causes it: age, advance in age, and sickle cell disorder. And then she made me understand it better that at times it can trigger a pain crisis, and then a pain crisis can also trigger that pain. So I kept quiet with it about that experience for like a year and a half. But the day I shared it publicly, I felt relief for a long period. And then the pain started coming back. So I got to understand that, wow, it gives me a form of relief. It gives a form of joy when I share it. And that joy, because of depression, it helps to improve my mood. So it's one of the things that God is using to help me to manage depression, because the things that will improve your mood, the things that give you satisfaction, that improves your mood, helps you to be able to manage depression. So when I saw that aspect about it, I do not put any restriction. So when I'm going through an experience, I'm having at the back of my mind that how will I use this experience to inform and inspire people? So I use that to do it. And then I have prayed and committed my family to God's hands, my children, I've committed to God's hands that God will take care of them. When I do God's work, taking care of God's work, God will take care of them. And so I'm not at all worried.
Amazing. Wow. It's I'm so I'm so inspired. Thank you so much, Doctor. And to everyone who is watching today, for me, Dr. David's story, it brings me to to something that we've always talked about, and which is the fact that knowledge is health. The more you know about the things that affect you, you're in a better state than someone who doesn't know. Because in some of the research we've carried out, we've seen that some of the preventable deaths that are happening in this part of the world, many of them are not only due to lack of access to health facilities or health professionals or healthcare, but also lack of knowledge on the right health seeking behavior. So oftentimes people eventually go to hospital, but they only go to hospital when the circumstance has become very nearly irredeemable. So we lost a patient 2 weeks ago. So in the advocacy that we're doing for maternal and child health. So this girl, she had whatever she had. I don't have the full history. She went to a nearby chemist, and then a nurse, in quotes, gave her injection. And this was later said to be a medication that is supposed to be IM. She was given IV. She got paralyzed on one half of her body, and they went to a traditional practitioner. She was given some herbs. At the time, she stopped speaking. It was then at that point I was informed. And then I told them to start going to the hospital. So they went to University of Ibadan, a teaching hospital. And at the time she was received, she was unconscious, was in the ICU. They did the best they could do. After 2 days, she regained consciousness. They reached out to me. They were so excited. But unfortunately, the following day, she died. Now, this person didn't have this experience because of lack of access to healthcare. She had this experience because of lack of knowledge on the right health seeking behavior. So every effort someone takes to know what to do or what happens when this is a situation goes beyond even protecting that person, but also protects the people around him. Doctor, there's something we call in health, it's herd immunity, where if a percentage of people are immunized against a particular illness, the people who are around them are nearly protected, especially for drugs that vaccinations that are still oral. So I came up with a theory that there's a knowledge herd immunity, where if one person in a community has the right knowledge and he is vocal about it, he protects the people around him. This book was inspired by my younger sister's death. My youngest sister's death. I was 10 years old. She was 8 months old. This was several years ago. She had febrile convulsion, which is normal for a child of her age. But they put her leg over fire, spoon in her mouth, onions in her nose, red oil over her body, put her leg over fire. Her legs were burnt. I don't know what it was. I was a child, so I can't say it's this degree of burn, but it was burnt so much that they needed to do screen grafts, that they took patches of skins from her laps to patch her leg. As a child, I know I heard antibiotic resistance. I heard it. I was 10. I could say I'm a very intelligent child growing up, which is why I studied medicine. That's how we all end up, right? So I heard it antibiotic resistance. So well, I don't know what it meant, but that was when it got stuck in my mind. So she had multiple antibiotics that at the time no one was working anymore. And she died after 3 months of hospitalization. I remember there were 11 adults in the room that night. My dad, my mom, and 9 neighbors who gathered. If one of them had the right insight, just one, they didn't need to be two, just one, the outcome would have been different. She probably would have been doing her PhD right now or be a doctor or just be anything she wants to be. But she just died. So, and that is why I'm so proud of what we are doing here. And I'm so grateful to Dr. David for sharing this. And I strongly
for the
pray,
opportunity.
everyone who have heard this, beyond what we've just shared, this is not a marketing. We didn't talk about your book as to, right? I got the information from Dr. Ifeanyi. She told me that you've written a lot of books about sickle cell, and I told her she'd allow me. I want to talk about it so much because I'm not an authority in this field. And even if I am, I'll be talking about it from a theory. Now, we have a material that discusses this so in depth. Now, we don't advise couples to keep giving birth to kids with sickle cell. If you're an AS, don't marry an AS. All right. But if that is where you are right now, go ahead and glean this information. One of the things I shared, I released a video last few days ago on my podcast on YouTube, and I said, because a lot of people reach out to you for mentorship. And I said to someone who was reaching out to me, I told her, I can see you're a very passionate person. You are going somewhere, clearly, but I'm busy in my lane that I can't start learning all about you to know how to mentor you. You're not a doctor, you're not even going on my path. And you're not even on other things I do, but I know you're inspired by the things I teach. So, two things you could do. First is go and consume all I've already shared because I teach a lot. I'm also a pastor and I do a lot of leadership teachings and all. So I said, almost anything you want me to talk to you about, I've talked about it already. So go and get the insight and put publicly. So that even if you need to have a conversation with me, to be a deeper conversation, I won't have to start going on the surface of what I've already spent immense hours developing. And that is what I'm saying to everybody who is listening. Because I know after this advocacy, people start searching you online. They'll check your YouTube, they'll start checking your Instagram, your Facebook, they'll start DMing you, especially parents, passionate parents. I'm telling them right now, the first thing to do is to go and read what has been said already. Now, I can imagine the thoroughness of the material because I've gone through one. So I understand the intensity of developing such work. So go ahead, study it, read it. Now, if you have questions from those things, at this point, I can tell you boldly, I have Dr. David's phone number, two of them actually. If now there's need for me to connect you to Dr. David, it will happen. At this point, it will be a richer conversation, not you asking questions and the answers are already there.
Thank you so much. I am delighted with the work you're doing, that you're a medical doctor and a pastor. God has put you in that center place to fight religious discrimination. Being in that position as a pastor, you are able to teach people properly. So that the place of science, God is not discarding it because God is a God of all knowledge. Rather, He's making people understand that I can do it by you using your medication. And without even healing you, I can still do it by you being a source of inspiration and information to other people. And in being in that position as a pastor, you are able to help people to able to fight that religious myths that most people carry around with diseases all over the world. You could still believe that in this 20th century, I was able to connect with someone that told me that a family stopped their child, a daughter who should be like 30 something in her late 30s now, from going further into the secondary school. She finished secondary school and they did not sponsor her to go to university, but allow her siblings. She is the first of the family, but they allowed her siblings to progress because a religious man, maybe a pastor, I don't know, or prophet, told them that she is the tool the devil is using to drain their resources, to drain their finances in the family. And so because she see her as the person the devil is using to waste their resources or to drain their resources, they did not allow her to progress to university. And her siblings have graduated from university. That is the power that religious clerics have over people, especially in countries like Africa, a continent like Africa, a country like Nigeria. So you being a pastor, you can properly educate them that no, that is not right. Unfortunately, many parents or many families that may go into that kind of problem, fortunately, when they meet you, they are set on the right path because you give them the right information. So, my pastor, my friend, my doctor, God bless you.
Yeah.
God
Thank you
bless
so
you.
much.
God
Thank you
bless you.
so
You are
much.
doing a noble job. God bless you.
Thank you so much.
I'm sure you caught a lot of value today. I'm so excited to have shared this moment with these amazing warriors who are making a real impact in the ways that they can. And Dr. David's books, we're going to put the links down here in the comment section. Get access to them, especially if you are someone who has people in your life or you yourself have sickle cell and see how the knowledge he is sharing could really be a part of impact in your life. Okay, and without making much time, next week we're going to continue on what we were supposed to have originally dealt on today, which is on labor and safe deliveries, which is what we're supposed to have done today. But because of the awareness and global campaign going on, we thought it wise to lend our voice and help to spread this news so that everyone will know how to take this issue of sickle cell more seriously. All right. So next week by 7 p.m. same time on Sunday, we're going to come in live with the episode on labor and safe deliveries. You're going to hear stories that will cause your ear to twitch, cause your mind to think, and get you to not make the common mistakes that make women to carry their babies successfully from conception up until delivery, only to have complications in their delivery. It's not supposed to happen. Tune in next week and have an amazing time. Until I come your way next time, Dr. over here, and peace out.